I'm Will Heyburn, Chief Financial Officer of Blade. We're here today to talk about our acquisition of Trinity Air Medical. We actually got to know Trinity from working with them directly on a number of cases here in the Northeast. And we were immediately struck by their high-touch approach to organ transportation, seamless end-to-end, including the ground transportation portion. Trinity has shown incredible growth in terms of adding new hospital clients for the last few years. And once we got to know them and actually worked with them on a number of missions, it was very easy to see why. They take a service-oriented approach to organ transportation, which is not something that is typical in the organ transplant industry. They also come from backgrounds working at hospitals and organ procurement organizations. They understand the inner workings of how this business works.
I'm Seth Bacon, CEO of Trinity Air Medical.
I am Scott Wunsch. I'm the Chief Operating Officer here at Trinity Air Medical. I've always worked in healthcare my entire career, and knowing that you can go to work every single day, making an impact, helping others, has always been something special to me.
In my job as a critical care flight paramedic, the idea for Trinity was born, and over the last 8 years, the stories that have been generated by the services provided by this organization are huge.
Between the technology, the resources that Blade brings to the table, along with Trinity's expertise and book of business and customers, joining forces, we're going to be able to provide something that nobody else in the country can do.
We've been able to have exponential growth and have done some amazing things. And again, the stories fill the hallways. And now I think about the opportunities to work alongside another very similar cultured company. I think that the sky's the limit with the two organizations combining our synergies for the future. I think everybody ought to buckle up.
Trinity's mission statement really spoke to us. They want to increase the number of organs that are available for transplant. The transportation is what unlocks that possibility. What Trinity brings to Blade is a portfolio of hospitals that are in dense urban areas outside of New York City that are currently using ambulances exclusively for that last mile transportation. It's a near-term opportunity for Blade to replace those ambulances with helicopters. They're going to save hospital times and improve outcomes for their patients. And the longer-term opportunity is to transition to electric aircraft, either autonomous drones that can carry cargo by itself or future electric vertical aircraft that are piloted and can carry the full transplant team with that organ to their final destination. There's been incredible advancement in organ preservation technology over the last several years, and it creates an opportunity for hospitals to travel farther to receive an organ that otherwise might have been discarded without a match. This is a great opportunity for Blade and Trinity to play a leading role in making that process possible. The transportation is everything, and by linking that chain of transportation, an ambulance, a jet, a helicopter, you reduce the amount of time in transit and you allow someone to receive an organ that they're matched with that otherwise would have been discarded if it wasn't possible to transport that organ as quickly as we can with this seamless system. This brings incredible benefits of scale to the combined operation. We'll have more availability, better pricing, and importantly for the hospitals, more redundancy in terms of multiple aircraft being able to service missions for when things go wrong, when unexpected weather moves in, when mechanical issues arise. Following the acquisition, Blade MediMobility will be the largest point-to-point air transporter of human organs in the United States.